My research involves diet and physical activity and how it relates to outcomes for people with cancer and people who are at risk of cancer. Low physical activity and obesity are both related to sex hormones, and sex hormones are related to several types of cancer, including breast cancer, endometrial cancer, and prostate cancer. Low physical activity and obesity also have an effect on insulin and glucose in the blood, and increasingly we're starting to see that insulin and glucose and diabetes are related to certain types of cancer as well. In the U.S. today, over a third of adults are obese, and obesity is really the class of overweight that is most associated with adverse health outcomes. I found out that Dr. Liu was planning a study looking at the effects of metformin on biomarkers related to the development of endometrial cancer. And I found it very intriguing because of a study that was done several years ago called the Diabetes Prevention Program trial that looked at the effect of metformin and lifestyle intervention compared to metformin placebo on the development of diabetes in people who are at increased risk. What that study found is that metformin decreased the risk of developing diabetes by 31%, but the lifestyle intervention decreased the risk of developing diabetes by 58%. So when I heard that Dr. Liu was doing the study on metformin to prevent endometrial cancer, I thought, let's do sort of a replication of the diabetes prevention trial and see if we can see similar effects of a lifestyle intervention on endometrial cancer-related biomarkers.
This is an important study because it's one of the first steps in really addressing the issue of obesity and cancer. So because endometrial cancer is the cancer that's most tightly linked to obesity, we really want to look at what we can do in terms of either diet and exercise or drugs such as metformin, how they can work to prevent cancers in individuals who are obese. So we want to look in this study at both the effect of metformin, which is a drug, and also the effect of what we call a lifestyle arm, or diet and exercise. So we want to see, do those two things, are they individually helpful, and also in combination, can they be especially helpful in terms of decreasing endometrial cancer risk?
Our study involves women who are obese and postmenopausal, and when they sign up for the study, they're assigned to one of four groups. One group will get both metformin and the lifestyle intervention. The second group will get the lifestyle intervention, but a metformin placebo. The third group will get metformin, but no lifestyle intervention. And the fourth group will get no lifestyle intervention, but will get the metformin placebo. They'll continue all those interventions for 4 months, and we'll look at the beginning and end of the study at their body composition, biomarkers related to endometrial cancer, and their behavioral changes. So women participating in the study will have at least two opportunities a week to come for some supervised exercise sessions. There are very few examples of trials that look at a behavioral or a lifestyle intervention like this one and investigate the effects of the intervention on cancer-related biomarkers, especially in endometrial cancer where we have very little research. There's also very little research on the combination of lifestyle interventions and chemo prevention agents to investigate their joint effects. So we're very excited about the possible implications of this study. Studies like this are important because they help us identify some of the specific mechanisms by which lifestyle behaviors can affect a disease process like cancer. I want to thank the Duncan family for supporting this area of research. We often don't have good resources in prevention, so this is extraordinarily helpful to us in advancing prevention and improving health in our population. Having this funding from the Duncan family allowed us to take advantage of a really unique opportunity. We hope the results of this line of research will also bolster the argument that it's not just medicines and healthcare that are important to our health and disease prevention, but what we do, what we eat, and how we manage our health in terms of our behavior.